Alrighty, good evening, everyone. My name is Isabel De Leon. I am a community health educator. Welcome to our live virtual event entitled Lymphedema. Just a few announcements before we get started with this presentation. During our presentation today, if at any time you have questions, please feel free to submit them through the Q&A portal located at the bottom of the Zoom screen. Please feel free to submit questions at any time, and after the presentation, we will have time to review some of those questions. And please keep your questions general. For any specific questions regarding your health, we recommend that you follow up with your physician. At the completion of the event, you will also receive an email from Community Health Department, which will include a link taking you to a survey about the event. If you could please take a moment to fill out that survey, your feedback is very important to us. Most of our live events will be recorded and posted on our Valley website with other topics /tune into health. We will be updating the site frequently with new videos. And now I'd like to introduce our speakers for this evening. Today we have Olivia Bell, who is an inpatient and outpatient speech language pathologist, and we have Tracy Tuminelli, who is an occupational therapist. They're both great people, and we're so excited to have them with us this evening. And obviously they're part of the Valley Health System.
Thanks, Isabel. Good evening, everybody. My name's Olivia. I am one of the speech to language pathologists at both our acute care hospital and our outpatient facility, and am certified in providing and managing patients with head and neck lymphedema.
And I'm Tracy. I'm an occupational therapist. By discipline, I'm also a certified lymphatic therapist, and I'm also certified through the Lymphology Association of North America. I practice at 505 Goffel Road for Valley, where I do primarily like 80% of my caseload is lymph. So we're gonna get started just to go over what is your lymph system. Your lymphatic system is a network of vessels that are running through your body whose primary function is to absorb fluid, waste in your body and transport it throughout your vascular system, or transport it from your vascular system and your fluids in your body and excrete it in your body. The lymphatic system absorbs waters, proteins, wastes, and skin, fatty acids from the intestines and deep lymph organs, and produces lymphocytes, which are responsible for recognizing and responding to foreign cells, substances, and microbes. So it really does help clean out your body and keep you healthy. The lymph system extends from the very top of your head to the bottom of your feet and is made up of a variety of capillaries, precollectors, collectors, trunks, and ducts that eventually end in the area between your collarbone and your neck, which is called the supraclavicular fossa. Our lymphatics are very close to the skin and they're very delicate. They're even smaller than the veins in your body. Our bodies are divided up within the lymph system to best move the fluid as efficiently as possible among larger areas of skin into territories, which feed our lymph nodes to be cleaned and delivered to lymphatic trunks and ducts for reabsorption or excretion of the fluid. Typically, there are about 600 to 800 lymph nodes in the body, with most of these nodes being found in the head and neck, your armpits, your abdomen, groin, and the inside of your knee. Lymph fluid flows in our body in a single direction and is not assisted through your body by gravity, but it's rather by an internal pumping mechanism. That's important just to know, because you'll recognize that if you have lymphedema, even if you have your legs up or your arm up all day long, it's really not going to make a huge difference. In terms of what is lymphedema, it is a chronic progressive high protein edema. That means it's a little bit firmer than the edema that you might get if you have hurt yourself or you have a cardiac condition that causes more of a water-based edema. Lymphedema is not gravity dependent and it's not successfully treated with diuretics. There's two causes of lymphedema primarily. Primary, it occurs at birth. Sometimes you'll see it right at birth. Sometimes you may not recognize it until after puberty. It can be triggered by hormones or an incident later in life. Secondary occurs due to a trauma to the lymphatic system, causing a breakdown to happen. So this could be a cancer treatment, a surgery, a vascular issue, something like that. If left untreated, it can cause an overgrowth of new skin and fat cells, which can cause weeping, wounds, and limited mobility. So it's important to treat this so it doesn't get out of control, like the picture off to the right. Okay.
Okay, some of the symptoms of lymphedema, like Tracy said, this is progressive, so early identification is key with lymphedema. It does progress through stages, which we will talk about a little bit later in the presentation. But if it's something that's identified and treated and managed early on, we can usually reduce the chances of this progression. Some of the symptoms that you may notice are limb swelling, asymmetry between the limbs, tissue changes in the arm, either thicker or more of a pitting edema, feeling of heaviness or aching in the limbs, tingling, swelling in the head, the neck, and the face area. Sometimes patients will complain about difficulty swallowing because of some internal lymphedema, and patients will complain about clothing or jewelry that may feel too tight or uncomfortable while they wear it.
So there's really 4 stages of lymphedema to be concerned about. Within each stage, there's different presentations and different ways that we might treat it. Stage 0, which is known as the latency or subclinical stage of lymphedema, occurs within your deeper tissues and progresses very slowly. So you may not realize that you even have or are at risk for lymphedema progressing. Changes are found on a subclinical level and may be noticed by just a mild increase of fluid retention, maybe feeling some tightness or heaviness in a particular limb, or maybe some tingling. They're not necessarily evident, but if you take preventative measures, engage in risk reduction techniques, you can really prevent it from progressing to stage 1. Stage 1 is spontaneously reversible. So this is, again, very early in the symptoms of lymphedema within the course of lymphedema. Damage to the lymph system is evident, but it's not necessarily present all the time. Swelling may come and go depending on the time of day, or occur for a period of time and then disappear. So you might have it for like a month and then it goes away for a while. Your skin may start pitting, where it leaves an indent if you press into it. And this stage, if treated quickly, you can prevent further swelling and maybe reverse it and get back to stage 0. Stage 2 is spontaneously irreversible. The swelling is evident and it won't go away. Your tissue, the skin becomes firmer, and it may or may not be pitting. Sometimes it may become fairly hard. Often people report this to feel very heavy, very tight. And often at this stage, you're at risk for wounds or infections, because with the stagnant lymph under the skin, you're accumulating all the stuff that needs to be exiting your body. And since it can't leave, it just stays there, and it can cause further infections. Stage 3 really is sort of the last stage, and that's sort of the maximal progression. At this point, the tissue is very hard, very firm, and your limb could be noticeably larger. If you notice the picture off to the right, here, very often you're going to have skin changes, scaly skin, dry skin. You could have wounds, some weeping, where there's just liquid coming out, and infections, cellulitic infections in particular, are very common. Treatment's still beneficial at this point because we can contain that from growing even larger, keep your skin healthy, help you become less at risk for infections, and be a little bit more comfortable.
Okay. So as Tracy said, there are about 600 to 800 lymph nodes within our body, and about 300 of those lymph nodes are located in the head and neck region. So while head and neck lymphedema is less common than lymphedema in the trunk or the limbs, it does occur in about 3 to 5% of all cancers. When lymph nodes are removed or when they're damaged, then, like we discussed, the transport system of this lymph fluid is then disrupted, and the lymphatic vessels don't pump at their normal rate. Over time, This can cause swelling to increase. This can cause tissues within your body to harden. And again, it is progressive. I'm just going to mute myself for 1 second. Sorry, the dog was barking. Head and neck lymphedema occurs in about 50 to 75% of patients that receive radiation and or surgery for any sort of head or neck cancer. So again, even though it's a smaller population of patients than those that have lymphedema in the trunk or the limbs, it's still a pretty large population for patients that would undergo any sort of treatment for head and neck cancer. And again, this too can range in terms of stages from a very mild case to a more severe case. Some of the most common etiologies in terms of developing head and neck lymphedema include surgery. So again, this would remove lymph nodes or damage some of the vessels or create scarring that would impact the flow of that lymph fluid. Radiation treatment for cancer can cause the tissues to stiffen or harden, and that fibrosis then impairs the mobility of that lymph fluid through the lymph vessels. A tumor in and of itself can cause vessel obstruction and make it more challenging for that fluid to move throughout the body. Some non-cancer etiologies that we would also see could include chronic infection, surgeries, maybe as a result of a cosmetic procedure, maxillofacial trauma. And again, this lymphedema may resolve spontaneously, or as Tracy said, it might disappear for a little while, but typically it's something that will progress. So that identification and that treatment and management is something that we try to get our hands on as soon as possible. The more severe the lymphedema, the more irreversible that edema becomes, and typically the more difficulty our patients will experience. Okay, so the treatment of lymphedema is multimodal, and it consists of a very light massage. If you remember, Tracy said in the beginning, those lymph vessels are very sort of fragile. They're smaller than even the veins in our body, and they're pretty surface level. So it's quite the opposite from a deep tissue massage, and it's more of a very light skin stretching that's called manual lymph drainage. It also encompasses compression using short stretch bandages or Velcro wraps, and it encompasses decongestive exercises. Upon evaluation with a therapist, we would help to determine what the proper course of treatment would include, and that would also include the types of compression we would recommend, and the frequency of your treatment would be determined at that time of evaluation. One of the things that we would love to highlight is how imperative it is for patients to strictly follow the recommendations. It's a well-researched area, especially now, and I think we have a lot of good evidence behind the reasons as to why we utilize certain techniques and why we utilize certain compression. So it really is a key factor that patients and caregivers buy into the process and follow these recommendations for the ultimate outcome. It's not uncommon that we get patients that will want to do part of it, but maybe not all of it, and it really will impact the outcomes that you are hoping to see. So ultimately, your therapist will help you to move into what we consider a maintenance phase of lymphedema, where compression garments would be recommended for both day and night wear. And then we would also work with you about any sort of ongoing education for self-massage, risk reduction, and just overall ability to better manage your condition. So again, this is a slide that's a little bit more pinpointed to head and neck lymphedema, but that lightweight, gentle skin stretching technique is something that would sort of go across the board. It's really gentle, smooth, rhythmic movements of your skin, because again, we're looking to just sort of stimulate that lymphatic flow. We're not doing any sort of deep tissue massage. With this movement, we're looking to be able to redirect that fluid flow to an unaffected area. The outpatient treatment that you see listed here in the home program is sort of a general overview to give you a little bit of an idea as to what to expect. If it's a patient that has more of a severe case, obviously the more time with the therapist at an outpatient facility would be recommended, at least initially, because you'd have the skill of the therapist to help with all that training, instruction, and education. We would encourage that manual lymph drainage about 3 to 5 times a week, patient dependent. And along with the treatment that you would be doing in clinic, the expectation is that we're also working to train the patient to do self-drainage and compression usage when they're not in the clinic. Again, if it's a more intensive patient for head and neck, it would be on the upwards of 8 to 10 visits. Again, we can increase and decrease based off of progress and what we feel is necessary for the individual. And then the home program, regardless of severity, is something that we're aiming to get patients to, where they would be independent, either the patient or with use of a caregiver or spouse, in being able to do their own self MLD and be able to independently manage compression pads and compression garments.
Okay, so I'm going to really talk about what the gold standard for treatment for lymphedema is. So if you've recognized the fact that you need to have some sort of treatment for your lymphedema, what the gold standard is complete decongestive therapy, which is the combination of manual lymph drainage, compression, and exercise. And that's going to be the first stage of it. So after you've been evaluated and you've determined the proper course of treatment, what you would do is receive manual lymph drainage to the limb. And although it's to address the area of your body that has lymphedema that might be swollen, it really is a full body massage, because we're trying to incorporate the areas of your body that are currently working appropriately. So if your arm really isn't working well and it's not draining, we need to open up the other areas of your body to be able to absorb that extra fluid that just can't be absorbed by what's not really working very well. So we clear other areas depending on what's available based on your diagnosis. And then we gently try to reroute where the lymph fluid is being drained to. So it might be to, an area on your hip. It could be to your back. It could be to maybe your other armpit or your other leg. And again, that's something we would determine. And as we're working with you, also teaching you how to do that for yourself. We also incorporate special breathing techniques to again, help further assist with that lymphatic pump. The goal is to get that fluid moving out of whatever area is affected and partially reabsorbed or get as much reabsorbed as we can and really get that limb healthy. After the manual lymph drainage, we do really reinforce meticulous skincare. So again, because the lymph fluid is holding all the stuff that needs to be excreted out of your body, we want to make sure that you're not at risk for cuts or wounds or any sort, making sure you don't have any infections. So we do assist with like cleaning whatever portion of your body we're working on. We do recommend a low pH lotion, generally Eucerin or CeraVe. And then we follow that up with an appropriate compression, whether it be with bandaging and foam, Velcro. It really depends on the person, as well as the recommendation of how many times a week. But if you're going to do the gold standard, generally that is 5 times. And as always, we reinforce exercise. So depending on why you're coming, we'll figure out what exercise is most appropriate for you in combination with maintaining that diaphragmatic breathing we'll teach you. And just really participating in a healthy lifestyle, eating healthy, exercising, any kind of movement within what you're available to do. And then just, again, you also being aware of what your skin is doing, just to stay healthy. Okay.
So again, in terms of head and neck, like Tracy talked about, that manual lymph drainage and the skincare and the education is obviously a huge part of this. But then once we get to the point where compression is something that we want to discuss, this is where, at least in the head and neck world, we have a little bit of less compliance, and I totally understand why, because you can see some of these compression garments are not necessarily the most fashionable, but they do really help with getting patients to the most optimal outcome. So these compression garments will provide support to the tissue. They help to enhance the actual muscle pump effect while you're exercising, and they're important to combine with that manual lymph drainage. So even before we see patients in the clinic or before they're getting ready to do their own self MLD, we'll work on utilizing compression to help with if patients have more hard, stiff fibrotic tissue, we'll encourage them to utilize that compression before they do the MLD to help to prepare the tissues by helping to soften some of that fibrosis. Once the MLD has been completed, then we encourage patients to put that compression on afterwards. And that compression is, the compression afterwards is a little bit of a softer sort of compression, and that's utilized to help to prevent any sort of refilling. And it again helps to promote some of that tissue drainage. So we oftentimes get patients that say that they're all for doing the massage piece of it, but they don't want to have to wear this crazy getup. But once they can buy into the process and they really see the difference as to how it minimizes that refilling after the massage, and the manual lymph drainage, they do in fact realize that it is a key factor in helping with this process. Even though these look like they're very, very tight, in fact, we're looking for something that has some of that compression, but not something that's going to squeeze and now cause fluid to be in areas that we don't want it to be. So it's not uncomfortable as much as I think just more of a getting used to the habit. In the head and neck world, that compression is not an all day sort of a thing. So I think patients that can get creative with finding times to wear that compression usually do a little bit better. I put at the bottom of the slide just some ideas and examples of creative ways to be able to utilize some of the compression, because again, especially for our patients that might still be working or that are still very independent and very social, this is not necessarily how they envision themselves going to work or going about the community. But if you can work it into ways where, okay, I can do it after dinner while I'm sitting on the couch watching TV in the comfort of my own home. If it's something that you feel comfortable with just wearing until you get to the office, at least you're finding ways to be able to incorporate that compression. First thing in the morning before you go to work. Longer wear time is going to equate to longer delay in refilling. So some compression is better than nothing, which is what we'll tell our patients, especially head and neck. But if you're going to be doing less than 2 hours after that manual lymph drainage, you're really not going to see the same benefit. So again, I think it's something that's not the most favorable initially, but patients really do see the difference. And it's amazing what their outcomes can be when they can get creative with finding time to be able to incorporate that compression along with their manual lymph drainage.
Right. So my part of this is actually a bit different than the head and neck portion. So it may not be as wonderful to hear as what Olivia presented. With our initial intensive phase of lymphedema treatment, we do optimally want you with 3 to 5 days. 5 days, of course, optimal, depending on the severity of it. That's really, like, if we feel we can get really positive outcomes quickly, if it's a more intense case, again, it depends. Usually we're having you do that intensive treatment 4 to 6 weeks. It could go longer depending on, again, your severity of it. Incorporating the manual lymph drainage, self-massage, the skincare, and then the bandaging and compression, which again is where we differ from the head and neck. In addressing lymphedema in a limb, or you could potentially have it in your abdomen, in your genitals, in your breast, in your chest. Compression is required 23 out of 24 hours a day. We pretty much ask that you leave what we put on, and you take it off an hour before you come, get showered, and then we just start all over again. A lot of people initially balk at having all that wrapping, foam, even the Velcro garments on all day long. But I often hear that they find that it's comforting, that they see that it's helping. They have better movement. They take off the wraps and they see, ankles they haven't seen in forever, or, the side of their chest feels so much smaller. They can put their arm next to themselves again. So really the outcome, really helps support going through all of this. But that's where the commitment lies, the buy-in of the 23 hours a day. We also recommend that you exercise in that compression because, again, it helps with that lymph pump, that external containment of bandaging or Velcro wraps or compression sleeves or compression socks really helps support the lymph system opening and closing and reabsorbing some of that fluid. So any exercise, moving, marching, lifting your arms up and down, getting up and down is very helpful. Following the intensive phase with that really strict wrapping and strict skincare and exercise, it's more of a maintenance phase where you and your therapist devise what's going to be most appropriate for you to maintain this reduction that you've achieved, whether it be custom garments, whether it be over-the-counter stuff, Velcro wraps, nighttime wear, anything like that would be discussed and determine what's going to be a best fit for you and your lifestyle, maintaining that 23 hours a day containment. Also, you doing your own self-massage, figuring out what time of day that works best for you and how to fit that most effectively into your lifestyle. We do try and have you follow up with exercises at home consistently. And we do recommend that you either follow up with your therapist or your doctor for replacing your garments every 6 months, because the level of compression decreases after 6 months, and you really need to maintain the appropriate level of compression that's recommended to you. There are a variety of levels of compression. So every level that you might see out on the market may not be the one that's appropriate for you. So again, that's why you need to have that conversation with your therapist. We just have a couple pictures here, not of any of our patients, but generally what you'll see change. You can see sort of how, again, this is an asymmetrical presentation. So, one side is larger than the other, and you can see the before and after based on the compression, the manual lymph drainage, and the exercise. And we do often see these kind of results.
I was going to say, Tracy and I were sharing a patient, and we had him down to only twice a week for head and neck, and he was seeing Tracy, I want to say 5 times a week. And literally from, a Monday to a Friday, the dramatic difference that he was able to see. And I think, he was diligent initially with really, you see a limb that's as large as some of these pictures, and you have a lot of patients that are willing to do whatever it takes to sort of get that swelling to come down. And it was a world of difference looking at him from, even just a couple of days of progress with him really committing and buying into the process of, her wrapping him and getting him to the point where, he's in this sleeve and his hands and arms look completely normal compared to what he initially had come in for. So it is really remarkable, the outcomes that patients can have.
So just to make everybody aware what contraindications or precautions for the complete decongestive therapy would be. If you have any acute congestive heart failure or cardiac edema, we would not proceed with this. Renal failure, most likely not, because the amount of fluid that we're pushing through your body would not make it safe for you. If you have a deep vein thrombosis, that's not being treated and not cleared by your doctor. And acute infection. So in terms of acute infection, obviously there's some things you want to look for. So we like to say fever, swelling, heat, if it's acute, if it's new, if you haven't had this fever, heat, swelling, redness, if it's very red. If you're usually pink, and you notice that you're getting redder, again, that could be a problem, and pain. So if it hurts, if it's hot, if it's bigger, if it's redder, definitely we would not be working with you, and we would suggest you go to the doctor immediately. And if you do have lymphedema, acute infection, if you see something like that, 100% go to the doctor right away, because it needs to be taken care of immediately. And if you have acute cardiovascular issues, chronic venous insufficiency, anything acute, we would want to have a doctor's clearance for. Precautions that we would think about and really have a good discussion with you and your doctors would be if you have any limb paralysis, if you have any neuropathies or impaired sensation, even balance. I know that's not on there, but because of the wrapping, if it's legs, we do have to have a good discussion about balance and who can help you out. And malignancy. If you have a cancer that is malignant, this generally would be based on what would make you feel good. We're not really looking at that point for a reduction, but really just to make you feel comfortable.
And in terms of the head and neck, the areas that we would steer clear of would include the hypothyroidism, if you have hypersensitivity to that carotid sinus area, because again, the way in which we're directing flow and where our massage is going to be is sort of over that area, and cardiac arrhythmia. Again, I know it's not on here too, but a general precaution that we would take into consideration as well would be malignancy. And also, if you're going through active treatment, or if you're going through especially active radiation, that would be a discussion that we would be having with the patient and with the physician, because if it's more of oftentimes we would sort of hold off until that radiation treatment was completed, and until some of that skin has time to heal. But again, to Tracy's point, if it's more of a palliative or a comfort sort of a thing, and the doctor felt that it would be it wouldn't cause more harm than good, then that would certainly be a discussion we would have and see if we could progress with starting lymphedema management at that point.
We do also see patients for the body aspect of it that are going through chemo or radiation more as palliative. We do avoid the area that's currently being radiated, but we can work around that. And just how do you start? So what we would need is a doctor's prescription, clearance from your doctor. Generally what we want, and it's not all of those that are listed up there, but depending on your need, what your diagnosis is, why you're coming, what's causing this, we might want a cardiology clearance or a Doppler. We may want to be cleared by your oncologist, your nephrologist. We may ask for special tests to make sure that your heart can support what we're doing. So again, depending on why you're coming, we'll ask you to get these things just to make sure it's safe and everybody's medically stable to proceed. Once that's good, again, we just need the prescription, and then we continue to work with you and your doctor throughout the course of treatment. And
I think we're fortunate in our outpatient locations where our front desk staff will actually help us to start this process through a little bit of an intake interview when patients call for these services. So we know that time is precious and everybody's busy. So if we can capture you ahead of time to help you to be proactive in getting testing done and things like that, we will certainly do whatever we can to prepare you as best we can to get you onto that list for an evaluation and then hopefully continued treatment. And that is the wrap up of our presentation. I know that there might be some questions that have popped up.
Yeah, I see a question.
Okay.
If the skin is very sensitive and easily ruptured because it weeps on and off every few months, is MLD still possible? Yes, absolutely. We do have patients that come to us with areas that are weeping, open areas, some wounds, and we are able to treat those effectively with the weeping. A lot of times that becomes much less with the use of compression. So that would be something, we'd want to see you like 5 days a week, but we can effectively treat that with the MLD and the weeping.
I don't have a great view on my end, Trace, of any of the questions.
Okay. No, that's it. That's all I got.
Alrighty, thank you both so much. That was a great presentation. Please don't forget to fill out the survey. After this presentation, you'll receive an email. And again, thank you both so much.
Of course, our pleasure.
Yeah,
if anybody has
thank
questions, feel free to give us a call and we'll help out any way we can. Have a good night, everybody.
You too.
Good
Thank you
night.
both. It was great to meet you.
You too. Bye-bye.
Bye.